Now, I want to jump right into our next panel, which is Katrina's policy legacy. We've got some wonderful panelists here. We've got Dr. Sheri Fink, who is both a trained physician and an award-winning journalist, and thus a reminder of my parents' deep disappointment in me. She's also the author of 5 Days at Memorial and a former New American Fellow. We've got Dr. Denese Shervington, the chair of psychiatry and professor at Charles R. Drew University, and one of the leading scholars of trauma in New Orleans and in the wake of Katrina. We've got Saket Soni, executive director of the Resilience Force, and it is moderated by my friend, Adam Harris, a senior fellow here at New America. I'll leave it to you, Adam.
Thank you so much, and hello, everyone. Thank you so much for being here today. And I was born in Texas, in San Antonio, right near Kerrville, right? So we're, still living in the shadow of Katrina, but we're also thinking through kind of this current moment of flooding, kind of across the nation, and it's really reminding us of the policy failures that we saw then and the policy failures that we're currently seeing now. So I want to ask kind of a broad question to begin. What do each of you see as the most enduring policy failure from that moment in time? And where, if anywhere, have we begun to make progress? Sheri, I'll start with you.
I would say that it's, to your point, the failure to prioritize or invest in the preparedness for rare but foreseeable and potentially catastrophic events. And there's just, we go through cycle after cycle after cycle of, being reminded that this is important. And, but it seems like the cycle continues.
For me, I think it's in housing, and in housing, it creates the stability from which people can rebuild their lives. And when I've looked at disasters in civil societies, prioritizing the needs of the most vulnerable so that they can find housing and begin to reestablish meaning, to me, is the worst failure.
Well, two things, I think. One, Katrina was supposed to have been and was called a 1,000-year storm. And since Katrina, there have been over $300 billion disasters, over 300 disasters that have caused $1 billion of damage or more. Hurricane Helene, that turned a corner and hit North Carolina, will cause $56 billion of damage and rising. And so similar to Dr. Fink, I think that 20 years of that has not really led to an extraordinary effort to prepare for disaster. We know the zip codes where disasters hit again and again. But also that lack of preparation has caused us a second failure. There's a very deep resilience divide in America. Some people can self-fund their preparation for disaster, and others, mostly people of color, rural people and others, cannot. And that division is a second policy failure.
I wanted to come back to something where you talked about stability, right? And where people say, if it's in housing, if it's in, your schools, it's that, why am I still here? What am I doing here? There's that bit of hopelessness that seeps in when the structures around you that you've known for a long time have collapsed, and there's nothing on that back end. We're 20 years on. Why haven't we begun to address that piece, or how have we addressed that piece? And then where have we failed in addressing that sort of mental health piece?
Right after Katrina, some folks from Japan came and they said, we're a culture of disaster. So I just want to underscore preparation is key when you recognize that. So I'm agreeing with everything that you said. And they took us to Japan and they said, the conversation in New Orleans about whether or not people should come back didn't even cross their minds. There's an island that had been destroyed, and it was like, we're going to temporarily house you in Tokyo, but we are building for you to come back. People in New Orleans were called, Black people were called refugees, criminals, and they were told that they really shouldn't come back to the city. That's very disorienting. New Orleans is a city of generations that's built generationally right after Katrina. A lot of older people actually came back into the city because that's where they wanted to die. And so if you're going to rebuild the help to people to recover their mental well-being and their resilience, they have to feel a belonging in the place where they were. And that's why I went to housing. It is kind of Maslow's. You need to have somewhere to feel is your home. And for a culture like New Orleans, people came back years after because they couldn't find a sausage in Baton Rouge that they loved. And it's because it represents the signifier for I belong here. I've been here for generations.
So when people have that, right, they have that sense of belonging, they have that place that they want to stay, that does make that preparedness even more important to say that we can get you out, but then we can figure out a way to get you back in a sort of safe and responsible way. And thinking about the recent Texas floods and that sort of regional infrastructure that Katrina, like, it feels like it should have made having that sort of infrastructure non-negotiable. Why haven't we made that kind of infrastructure non-negotiable? And Suck it, go to you on that.
Well, you talked about belonging, and the loss of belonging in some ways is sort of at the heart of the fracture in American politics. And after hurricanes, floods, and fires, tens of thousands of people at a time literally lose belonging. They literally lose their homes. Their homes are damaged. And it is a good question of why those homes aren't built back. There are probably a spectrum of answers, but the one I would hone in on is that there is an extraordinary blind spot in America to who has to do the work. Homes have to be built by somebody. Homes have to be built by workers. We say that FEMA and the Army Corps of Engineers are doing the rebuilding. But just to reframe that, after Katrina, FEMA and the Army Corps of Engineers were relying on thousands and thousands of workers, itinerant workers, migrant workers, who were doing the rebuilding. And if you don't invest in those people, and not just the physical rebuilding of homes, but all the labor that goes into resilience, from healthcare to home building, to mental health, to teach, to everything else, if you don't really invest in the workforce, then you don't get infrastructure. It's just the math. And the United States is particularly bad at investing in people who do the work.
Speaking of people who do the work, Sheri, your book really, really dives into the sort of ethical decisions that are made during disasters, right? We saw the ethical failures. We saw the sort of lapse in policies that would support, like, this is what you do in this situation. This is what you do in this situation. How have our medical systems, legal systems, institutional systems really evolved or not to prevent those sort of ethical failures or to enshrine some sort of structure to situations like that?
It's a great question. I want to call out that the book's editor is here today, Vanessa Mobley, and she deserves a huge amount of credit. I don't know where she disappeared to. Back there, she's. And also to New America for allowing me to be a fellow while I was writing it, and thank you. One of the things I like, I didn't come up with this, but this idea that the greatest ethical failure is the failure to prepare. So, there were all these like horrible dilemmas, life and death dilemmas in the moment in Katrina, or in the aftermath of the levee failures, let's say, what it really was. And in hospitals, which is what I focused on. But, that's number one, is like, let's prevent them, let's prevent these horrible ethical dilemmas from ever being faced. And you do that by investing in preparedness. So that's like the overarching thing. In terms of the specifics, I do think that the big ethical dilemmas that occurred in the hospital that I wrote about, there were two primarily. One was sort of, what do you do at end of life if you think somebody's not going to make it? And there was this question of, that was sort of the flashpoint of the legal cases there, where a doctor and two nurses were arrested and accused of intentionally hastening deaths because the situation was so desperate. So, but the other big dilemma that was that I see over and over and over again in disasters is, what do you do? How do you prioritize who gets life and death resources when they are overmatched, especially in an acute moment in a crisis? And there has been a lot of has been a lot of focus on that after Katrina, and sort of like, how do we move the deck chairs around in the Titanic to, I mean, that's the horrible way if you're all going down. But let's say you do have some resources. So, who gets the ventilator? That was actually something that was, um, a big focus of lots of different committees and different states. In fact, hospital preparedness funds for some time, federal funds, which are now being proposed to be zeroed out in the new budget. But hospital preparedness funds at some point required hospitals and states getting the money to like do this kind of exercise. How would you prioritize resources in the best way if there weren't enough to go around in a crisis? And the plans were very problematic. They were like small groups of people, the people you would expect, like well-meaning but professional class, leadership, coming up with these protocols and doing their best to try to be fair and ethical and have some, maybe we go for the greatest number of years of life as a goal, or, the greatest healthy number of years of life. But there were discriminatory provisions, and I wrote about them a little bit, but it wasn't till COVID, and it actually looked like we were going to ration, that folks woke up and that there was more societal input in these. And so I would just say that to answer your question, there has been more work. There was intervention from the Office of Civil Rights at the Health Department, both under Trump 1 and Biden, to make these protocols more, less discriminatory. But when I went and reported in hospitals during COVID, there is such a gap between the theory of how you would like give resources out in a way that makes some sort of ethical sense and the actual practice of it. And it's just, I would say it's still a messy issue. Long answer to your question.
Yeah, no, I was gonna ask about COVID, because I remember at the very beginning of the pandemic, right? I think it was um, uh, Rudy Gobert from the Utah Jazz at the time, who had COVID and ends up getting treatment. And people, it seemed like it was being rationed to, okay, if you're an NBA star, if you're an actor, if you are a politician, you are going to receive some sort of treatment. When those who are maybe in a rural hospital in a place like Utah, Alabama, you're going to be a little bit more out of luck. I- I- Is there a way to standardize that practice, right? Because you're talking about, it sounds good in theory, but when it comes to practice, is there a way to standardize
Well,
that
so
practice?
that I should have explained it better. There were all these efforts to create standardized protocols, but the point is, it's really hard to anticipate in the moment like what you're going to be short of and which population will need the resources. But overall, this is a huge. You're absolutely right. Like on a individual level and also on a world level, think about where the vaccines went when they were first available and how much of a discrepancy between rich countries and poor countries. There was some analysis of like the millions and millions of people who died in the interim, while countries that couldn't get access to those resources were waiting for the vaccines. Like if it had come in a more equitable fashion, where the sickest or the most vulnerable people were prioritized in every country before the less vulnerable people were given the shots, that many more lives would have been saved. So just there are many, many layers to it. I guess the takeaway is to try to promote an equitable type of distribution, and also to produce more and faster and in more places, and empower that kind of technology transfer. And so I always yeah, I'll just say my last point is that sometimes when we get into these, who should get these limited resources, the real question is like, why are the resources limited? Can we make more resources? Then we don't have to make the tragic ethical choices. So that's my bottom line.
Yeah, and so thinking about that question, right? It's becomes a question of scale, right? Like, why are we rationing when we could have, you know, some sort of abundance, right? Of items, right? And Denise, I was thinking about that and thinking about your when you think of preparedness and housing, and also that sort of mental health toll, like what sort of scale after an event like a Katrina, right? Like, how do we scale the sort of interventions that are going to be necessary in order to make people feel like they can belong to that area again, to ensure that they're mentally sound?
Um, I just wanted to respond a little bit to what you said, that this is a society that's always functioned with overriding value that there is a lack of value to, there's a hierarchy to human life in this country. It started out badly, and from the early genocide of the people who owned the land to the enslaved people, and then the migrants come in. And I think no matter what policies or protocols we have, individuals who are steeped in the culture to which they identify make these decisions. And you're at the point, the ventilator, it's the nurse, the doctor, and it doesn't really matter what. It's who is this person who is going to make this decision. So I just wanted to remind us that policies don't necessarily mean that the right ethical things are going to be done. Um, when we look at what happened in Katrina, and I just want to lift up the poor people, the people who were left to die. Sitting here talking about it, it's like I don't want it to be an intellectual exercise. Um, we say the official number is like 1,200. I mean, yeah, 1,012. People who work in the death care business say multiply that by about 5, because long after bodies were being discovered, we have to have healthcare systems, if we're talking about mental health, that now will prepare for how do you respond to people's mental health, emotional health after disaster. That's not what we are prepared to do. We're barely prepared to work with people when there's no disaster. It's a whole different approach. It's not just, it's not around medicalizing. It's about human goodness, human love, human compassion. I think that's the best thing we can do to help people to rebuild their lives. And that's what did not happen in New Orleans. The myth and the criminalization of the Black body, the killing of the Black body. So when decisions were being made, remember, our bodies used to be used as experiments for science. So we have to grapple with these things before we can move forward with a new America.
And Saket, I want to give you a chance to respond to that as well. But also, right, thinking about that intersection of race and class and disaster response, how should that shape how we're preparing for future climate emergencies, not only in terms of the infrastructure that we're setting, but also for those people who are going to be on the ground responding to the actual emergency in that time?
Well, I think we really have to um, look at this question of resources through a lens of incentives. So, you know, since Hurricane Katrina, as there have been increasing numbers of disasters, on one hand, every disaster has been, an event of extraordinary grief and tragedy. Um, you, you know, we cannot adequately put into words the misery and suffering. Um, I'm a labor organizer who spends most of his time in disaster zones. I started after Katrina protecting workers who every morning at 5 a.m., my days would start at 5 a.m. when workers would gather in a place called Lee's Circle, literally under a statue of Robert E. Lee. Black and brown bodies standing under a statue of Robert E. Lee when right at dawn, contractors would pull up in buses. People would, get into buses, go into the dark, distant corners of the Gulf Coast to rebuild. That was day in and day out the rebuilding of an American city or of an American region. And, you know, riding on those buses, I got to see very, very closely up front and have seen for 20 years just the extraordinary amount of grief through disasters. At the same time, as disasters have grown, they have also become extraordinarily profitable. So it's not that there aren't resources. As a matter of fact, resources are increasing, by orders of magnitude that most people don't understand. These small, tiny companies that sprung up after Katrina to recover homes, to rebuild homes, are now massive firms owned by private equity companies. So, billions of federal dollars, billions of insurance dollars are flowing through what is surely going to be seen by historians as the American industry of our time, an industry created by climate change. And in the middle of that industry, workers who I represent are still earning $6 an hour and are falling off roofs, breaking their backs, and dying of toxic mold. And uninsured homeowners aren't getting help. So, that is a moral question. It's not a question of resources. It's really a question of a society's priorities.
Right. And we should say, right, this is all set against the backdrop of, an administration that is trying to eliminate FEMA, right? At least, and now they're sort of walking that back and saying we want to,
Yeah.
it should be in a different light. Actually, I had to write this one down to make sure I had it correct, right? So last month, FEMA's National Response Coordination Center head, Jeremy Greenberg, resigned as the administration moves to disband FEMA entirely. More than a dozen senior staff jumped ship afterwards. So given what Katrina taught us about the importance of that stronger federal response system, what does that leadership loss signal about our vulnerability today? And how should we be rethinking national capacity before the next major climate disaster?
Well, I think it's quite easy to predict that in the coming years, at least during this administration, disaster responsiveness will essentially come down to an act of political patronage. And it'll be a very scattershot political patronage, not a very well carried out political patronage. But when someone needs help that is politically important, then they may or may not get help. But just to take a step back, we need to understand what is FEMA. FEMA is essentially a part of the government that sends money to the uninsured. That's fundamentally what FEMA is. If you have a home that is insured, then insurance covers you, right? But increasing numbers of people in this country have been losing their home insurance, right? And so FEMA was meant for them. Now, the legislation that enacts disaster relief in the United States is from initially the 70s, then the early 90s. these legislative vehicles predate Katrina. And they mostly had in their mental imagination small river floods, like the one that happened in Pennsylvania. The kind of disasters we're seeing far outstrip even the original policy imagination that invented FEMA. So what I think all of us in this room and other rooms like this need to do is really start to figure out now what should replace FEMA. What is the next act of American humanitarianism that bakes care and concern into the policy code? That's really what we need at the state level and the federal level.
And Denese and Sheri, actually, that's along that line, right? What are the lessons from Katrina that are still not reflected in state and federal emergency planning? And what would you like to see reflected in that state and federal planning?
I happened to be in California during the Altadena fires. And again, it's the hierarchy and the division around race. There has got to be, even though I'm supposed to be talking about mental health, but mental health starts with you feel you're grounded somewhere. There has to be protections for people who don't have the voice and the capacity to really fight with the people who are exploiting disasters. And there's the whole industry that has grown up with that. So I think those basic things need to be addressed if I'm talking from the perspective of just one's well-being. Most public mental health systems are not equipped, or universities, to manage the kinds of post-disaster conditions, psychological conditions, and health conditions that arise. Right after Katrina, it was observed that Black people were dying at rates 4 times than before Katrina. So we embody all of who we are, and our physical and mental health is something that we need to try to assure. Again, there are countries that are a little more concerned or caring about everyone, tends to have health care provisions to provide kinds of supports that did not exist in New Orleans. And then what happens as our experience at my nonprofit there, the Institute of Women and Ethnic Studies, and that was hinted to during the first discussion, Black bodies, Black children become criminalized. Their mental health conditions, the dysregulation they experience, is seen as criminal behavior. And we feed into that school to prison pipeline, healthcare to prison pipeline, and we have to begin to have these conversations. We saw a rise in dysregulated behaviors. We're talking about COVID. That happened for children in New Orleans. And I think it's going to happen in Altadena. And so these divides around race and class, we cannot ignore them because they've always been here.
I guess to answer both of your questions, both about FEMA and the changes that have been promised to us or threatened, however you want to look at it, and also like state and federal emergency planning. And it's a huge question, and I love our panel having so many different disciplinary expertise because there's so many. It's not a simple. None of this is simple. But I would say I hope that. I guess a lot of recovering from horrible disasters is making some sort of meaning. And one of the big ways you can make meaning out of, of loss and pain is to learn from it. And so may this last week be a reminder to us of the importance of these elements of our government, of the importance of, that sometimes our taxpayer money, there are things that government does that are really important. And so perhaps this will be a reminder. We hear less about completely getting rid of FEMA, and maybe it will be a chance to think creatively about how to stir things up and make things better. I mean, fortunately, that's easier said than done. And a lot of times change is just really hard and you build layer upon layer with that. Um, but I think, that's perhaps one hopeful takeaway. Um, but in terms of state and federal, I think one of my big takeaways, I spent like a year looking at the aftermath of Hurricane Harvey, and this one particular woman's death, but I used her death to explore the entire response system. Like she had a medical emergency in a house that flooded, and that house didn't flood like life-threateningly, but the water was around her, so rescuers couldn't come easily, and the 911 system was overmatched, and there were lots of calls coming in. And so why didn't the disaster system pick out the people who were actually in a life and death situation? Because that's what your response system is supposed to be able to do in a big crisis. And one of the big takeaways from that, and she died, a young mother, and other people did too. And it is that these systems, federal, state, local, like really local, and community preparedness, because one of my big takeaways from like a career spent looking at disasters is that it really is like you and me, our ability to respond in the moment of a crisis can make a real life and death difference as well. And we don't often think of like all of us as first responders, but that is exactly what we are. And we need more of that type of a mindset that looks at, everyone as part of the system. And what the big takeaway from that Texas Hurricane Harvey, Houston area flood and crisis and failure to get the vulnerable people prioritized is that your system is as strong as its weakest link. And so if you destroy FEMA or you like take out this or that part of a system, it's real dangerous because, one of the stories I was paying attention to, you probably all heard it too, was like this one guy who took the early retirement, who was like the local FEMA coordinator in the San Antonio region or something like that. Like his job had something to do with like communicating with the people who they were serving, like that area. And like that's a really important person for all the technology, for all of the planning. It is really, and this was said to me over and over when I was researching the Katrina book. It's like knowing who's in your foxhole, knowing that is priceless. Sometimes that one phone call or just having practiced, having been in that area, caring about it can make these connections. It's not all neat. It's not all like you create this perfect system and then a disaster happens. It's much more like the crisis hits. It's always different from what you expect, and you have to be able to pivot. And those, human relationships. So every part of that chain is really, really important. And so I just hope that when we have crises like Texas, that to honor the people we lost, that part of that is remembering all of us, all of society, whatever your politics are, that this stuff is important and that we need to keep investing in it. And if we're gonna change it or cut it, we need to do that in a really smart way.
And Denise, I want to come back to you to talk about pathologizing behavior and the ways that they pathologize behavior in the aftermath of traumatic experiences. But I want to stay on this idea of kind of that local community support and knowing who's in your foxhole, because I've thought a lot about like the floods in North Carolina or the floods in Kentucky, and like these sometimes really remote areas where you might have had one hospital 35 miles away. I often talk about so my family's originally from that Utah, Sumter County area in Alabama, and you have to drive 35 minutes to Demopolis, or you got to drive 45 miles to Tuscaloosa, or you got to drive, 35 miles out to Meridian, Mississippi to get any kind of care because Hill Hospital was closing. And so, in places where we're about to experience severe Medicaid cuts, some cuts that those hospitals really relied on, and that may mean the closing of their doors, right? We may be losing some of those resources. So, uh, like, you've talked a lot about that sort of ethical piece of this. Saket, you talked about this. This is a moral question that we're really dealing with. So I guess I'm just really struggling with that, right? That we are closing rural hospitals in a time where climate disasters are going to get worse because of the ways that climate change is affecting people, and it's not just going to happen in big cities; it happens in these rural areas as
I
well.
just want to correct myself because it was National Weather Service. I'm just remembering it was the guy who was like the community outreach person. And the big issue here was that the National Weather Service had the warning, but it didn't get to the people who needed it. So pardon me, I think I misspoke and said FEMA. But to your point, and I'll pass it over, but I think that one of the big takeaways from, at least from medical preparedness, is that like the better you do on a daily basis, the better you do in a crisis. So if you have fewer rural hospitals, you know, that is not only impacting your everyday healthcare, which is super important, but also, of course, your ability to be resilient, to respond, to have those institutions which we rely on in a crisis to be there. And so it's those are really tied. The better you can do, and that also is a key. Just when we think of policy or where money goes, and you think, well, okay, it's a societal triage. Let's say that we can't, you know, spend money willy-nilly for things that might or might not occur when we have so many daily you know, priorities. However, there are investments that you can make that are like dual use that will help you do better every day to be more efficient. I'm thinking there's certain like types of like power plants that are also more resilient in disasters. So, you know, thinking about you know, like our creative people in society who can think of those solutions that both work for us on a daily basis and help us be resilient in disasters and mitigate hazards. I think those are real good investments.
So on the piece about pathologizing behavior, because I thought it was really interesting what you said. You know, thinking about after Katrina, the way that they said, Black people are sort of criminalizing the behavior of young folks. Have you seen any ways where we have shifted away from pathologizing behavior that is a normal response to a traumatic situation?
No, because I cannot talk about Katrina, New Orleans. The race and class, and race in particular, just runs through everything. And it doesn't matter about policies, higher moral standards. Somehow it always breaks down for us. So what happened even in the rescue in New Orleans, Black people were least likely to be rescued. And there's this myth, and I use all opportunities to make this public, because we know this in the community. The idea that Black people were shooting down helicopters that were coming to rescue them. If that happens, that means you're really crazy. People were acutely stressed and traumatized. They, however, noticed that when the helicopters came down, created a lot of turbulence in the water, Black people weren't being picked up. So the people who cared in the community, they said, well, we don't want them to come down because they saw people dying. And so they shot at them. We know you're not going to pick us up, so don't come look and say, I'm not picking you up. So to respect that in any disaster, the first response we have is fight or flight or freeze. That is not extended to us as people of color. And then after that, you need a lot of psychological supports. You need a lot of people coming to say, we're here with you. We saw what happened after 9/11. The country really said, we're going to help you, New York. We love you. No one said that about New Orleans. We were refugees. We had a president's wife who said, we were lucky to be up there in the Houston Astrodome. People were suffering. The former mayor went into the Astrodome and he really helped to make people feel good. They begged him, help me. They were not being helped. So if we're within a society that sees other people as not being worthy of caring and loving and knowing that in a disaster, people will get dysregulated. But if you give them the supports, all the data shows people will have an acute stress disorder, they get supports within 2 months, they're back to normal. That happened in New York. The PTSD rates fell in 6 months back to normal after 9/11. In New Orleans, it did not. For years, my organization kept track, and the rates they rose to the level of returning vets, and they have not returned down. That, and so what happens again, and I'm back in the schools where we were, when children are traumatized, they don't have the language. They don't know to say, this is what's going on inside, but they will show you. And our system was not prepared to care for these kids. There was a lot of movements. It happened with COVID too. Kids were being put into the juvenile carceral system rather than kids. The kids are hungry. They weren't in school. They had a lot of debts. There were more debts in Black families than they were, and if you were poor, because you're probably an essential worker. None of these, I don't even want to call them gratitudes, but just an extension of the humanity of us all. They're not usually afforded to poor and Black people. And now we can talk about brown people who are immigrants and are being othered in the way we have always been in this country.
So I wanted to ask about, you mentioned the ways that private equity is buying up. They sort of come in, they buy up the housing, they rebuild housing in different areas. And thinking about the fact that more Americans now are renters and how FEMA is to help, homeowners who may not have homeowners insurance. Of course, there is renters insurance, but is there a sort of FEMA equivalent for renters? And sort of informal housing, because that gap, right, not only reappears post-disaster, but it just sort of grows post-disaster.
For 6 months a year, my team and I embed with workers who travel from disaster to disaster. And so we follow them into cities and towns that have been flooded, hit by hurricanes. And you see a spectrum of people in different housing situations. The people who get the most help are white homeowners who are insured, right? They are most likely to recover from a hurricane. The people who are often the least likely are renters and people in trailer parks, right? And it's pretty stark and it's pretty clear. And it gets to what I was talking about earlier, this idea of a resilience divide in America. We're very used to the fact now, and in part, Katrina taught us that disasters reveal inequality and exacerbate inequality. Much less understood are the ways that recoveries drive inequality. The way we do recovery in America, it's not just that recoveries fail some people. It's that the very code, the very strategies, the very policies that we use to drive recovery in America, recoveries have become a hidden driver of American inequality because they were always designed to come to the aid of certain kinds of middle-class homeowners. And most other people were in the blind spot. The problem is that most Americans are living in the blind spot, right? So you've got recoveries that cause cumulative disadvantage, recoveries that compound inequality. If you're an African American homeowner, you're much less likely to rise up in a recovery than a white homeowner. If you're a renter, it's almost guaranteed that you will not get help. And so that's one issue. I would say FEMA is not the only agency, though, that is implicated here. HUD has a big role to play in disaster recovery and disaster relief. There's an entire disaster social safety net. There's disaster unemployment, disaster SNAP that are meant to come to the aid. Um, and the paradox you named earlier is about to get incredibly painful for millions of Americans, right when there is a massive scrapping of public funding, the safety net, and other things. Right at that moment, there is a massive rise in climate disasters. And so people are about to, enter a much more painful period.
I guess to that point, right? It's almost like there's a philosophical question of like whose responsibility is it to help someone, like generally, right? That's like we have this empathy issue in America where it's, well, you decided to buy a house down there or you decided to live down there, where it doesn't necessarily comport with like the structural reality of this is where my family, say, if my family came in Charleston and then we ended up working our way down to Alabama and now we live on the Mobile Bay, but that's where we live because we can't move. And another fellow, Abraham Lesgard, right, has a really great book on the move where he talks about the people who are going to be able to move away from where climate disasters are expected, right? I think he says in 50 years the bottom line of like the real livable area where Texas and northern Alabama is now is going to be like northern Alabama moving up to sort of Virginia. And so some people are going to be able to escape that, but those who aren't, it may be a political question. Nobody really like nobody on this panel may be able to answer it, but how do you get people, in the same way that we've forgotten that education is a public good, how do you get people to believe that disaster response is a public good when even in the midst of a disaster, people are saying, well, nothing we can really do about it in the aftermath? And this is for...
Well, I mean, to that empathy piece, I feel like people do care in the aftermath. There was like a ton of money donated after Katrina and every disaster. And I was a responder actually post Katrina and many disasters. And like, I want to shout out to the workers, to the responders, to the people who risked their lives. Like there are a lot of people who do care. I think the problem is like we care too much in the moment and we don't care enough ahead of time. We don't care enough about these conversations that we're having here about, well, this is foreseeable, so what do we do? And then we don't care enough in the aftermath that you were talking about, the long tail of a disaster, which is when like the depression hits. I feel like in the moment people rise to the challenge and they, like almost don't even feel their feelings. And then those long years after, and when it sinks in, like how long it's going to take to rebuild and what that looks like and all the problems. So maybe like we do care, we're human, but maybe it's like a problem that we care most when it's on the TV or we see people, like in the acute crisis.
So not seeing the long-term effects, but rather just the sort of short-term, okay, I've given my money, I haven't seen it anymore, but
It's not, I
even
don't
when
think
it
it's
goes out of sight.
intentional, but
Yeah.
like we need to extend that empathy to, because there are a lot of people who care or who are touched by people suffering. And so how do we then transition to like extend that empathy to the investing in preparedness and those parts of government and all of society, our personal preparedness. Come on, like you are told every year you need to, like this is a crowd that has the resources. How many of you have your disaster plan? How many of you know what is the most likely, foreseeable, unlikely event that could happen where you live? And what about the vulnerable people in your community and neighborhood? Like, are you involved? So we need to take that from our individual level all the way to the highest levels.
We're going to do Q&A in a little bit. I have a couple of more questions. I guess one of them is knowing what you all know, kind of having reflected on this legacy of Katrina for the last 20 some odd years. If you could design one policy or sort of structural reform that responds to those failures, and you've sort of answered in kind of throughout the conversation. But if you could assign one policy that responds to the failures of Katrina, what would that be? And what's standing in the way of that becoming a reality? And Saket, I'll start with you, and then we'll work back this way.
Well, my one policy would have 27 parts. um, I think that the policy panel of a day like this is sort of sometimes cursed with the most joyless uh, mood hanging over it. But I just want to change that, and I want to talk about my members. So after Hurricane Katrina, or after the levees broke, more accurately, there were over 1 million homes to be repaired in Mississippi, 1 million more in Louisiana. And just to put this in context, the fires in Los Angeles caused about 12,000 homes to be damaged. We're talking about 2 million homes to be repaired. Now, all these homes were repaired by migrant workers. Some were immigrants from outside of the US. Many were also US born, but had come from other states, right? And for 20 years since then, these workers have gone from flooded town to hurricane city, from fire to flood, repairing homes. And along the way, what has happened is that they've acquired extraordinary skill. And if you don't think these are skilled workers, try getting up on a roof and repairing after a hurricane, right? Actually, don't do it. They've acquired skill, but there's something even more profound that they've acquired, which is a very, very deep sense of vocation, a deep sense that this is their calling. So you've got this professionalized workforce that is still unrecognized, still underpaid, and nonetheless doing incredible work under terrible conditions. And I actually think that is one of the extraordinary legacies of Katrina. This workforce that for 20 years lives in cars and sleeps on the floor of a Home Depot, and nonetheless wakes up in the morning to rebuild your home. And so I just think, what could happen if the United States scaffolded these workers, protected them, and actually turned them into a professional workforce that many people, US born, could be recruited to? We're doing that in California, where CAL FIRE has understood that you need a preparatory workforce, and people who used to be earning minimum wage, we're now getting them jobs for $35 an hour, right? Doing ecological preparation for fires. Every era in American history has seen the rise of new industries that need new workers. Sometimes those workers have been ignored, sometimes they've been supported. And I think one major policy correction I would make is to move these workers from unrecognized to recognized, so that a massive, at-scale, skilled preparation can actually take place.
Good. Denese?
Well, my policy would be to support your policy. No, it gets to the heart of who we are as humans. And, I was thinking on my own, I would probably think about policies around public education, because, our brains need to have inputs different from the tribe in which we were born. And in very ethnically diverse communities, when starting in preschool, when children begin to see other children and that they're just like me, they begin to have empathy and love. And to me, so if we would really reinvest in solid public education where we do not have the racial class divide that we have now, then you would have a human force who would say, yes, these are good people, they are deserving. But I think until we recognize that as human beings in a society where the value is so capitalized, and we don't see human value across differences, then we will be having these panels after every disaster.
Which we always do. Well, I was laughing when Saket said having a multi-part answer because so you helpfully gave us that question before we came here and I couldn't settle on one. And I see it all as so complicated, but I guess I would just say, I'm going to give 3 baskets. One is if we're talking about infrastructure, it's like always, like power and communications that go down and like amplify deaths. And so, something around incentivizing real improvements in that. And there have been efforts over the years, but we could do a lot better. We could really do a lot better on, not losing cell phone coverage in a disaster or improving cell phone coverage in areas like in Texas and Kerr County where people couldn't get cell phone alerts. So that's one, like infrastructure. Then it's like the organizations and the people. And I would say, some policy that makes everybody do lots of like drills together. Because when you do a drill, just think about like that camp or the area, if they had done a drill and realized the vulnerabilities, would that create some, oh my gosh, we got to invest in this or that. So I do think, like doing that more. It sounds really boring, disaster drills, but and then involving all different sectors and all of us, like some sort of incentives to get individuals who are not official responders to look at ourselves as part of the solution in these crises. And then my last thing would be just something like multi-year grants and like not, like every administration. And like not making it a bad thing to reveal your vulnerabilities. As a journalist, like you see these things and then government or the company or the housing, organization that, oh, no, nothing's wrong. Like reveal the vulnerabilities so that then we know as a society where we want our public dollars to go. So I could just go on and on and on.
We have time for a couple of questions. So if you have questions, please raise your hand. There's a microphone that will come around. If not, I can always ask. Over here.
Hi, Ted Johnson with New America. My question is about how much of the policy failures in Katrina were actual failures of policy versus failures of like execution and administration, which is to say, do we need a new suite of reforms to fix these things, or do we just need better people, better leaders that do what the laws and policies are, or the laws in particular already direct?
I just want to quickly say, I just reviewed the congressional report, A Failure of Leadership, and it's exactly what you said. It wasn't the policies, it was the leadership. So thanks for that.
And that's true all the way into an organizational level. If you look at hospitals and the ones that did better and the ones that didn't, this is totally anecdotal, but leadership is so important. Being able to communicate, being able to keep spirits up, thinking creatively, having that mindset, making people sleep who work with you, so they can think. So leadership is really key. And interestingly, the hospital, there's some accreditation bodies that have like, over time, there have been some improvements and investments in like requirements for minimum standards and preparedness for our health providers. And in one recent iteration, they really like said, oh, we got to take this out of just like the disaster guys who work in the basement and have the drills that annoy everybody. And it's got to go to the CEO level. So yeah, so all the way from the top levels of government to whatever the local structure is.
Yeah, I think at this point, sitting in 2025, we need both. We need better leadership, but we also need new policy that matches the scale of climate disasters. In Louisiana, last hurricane season, I met a couple that were living in a house their family had lived in for 4 generations. During the FEMA response to the hurricane that recently hit them, they were told their house couldn't be covered because the damage to the roof was not a result of the hurricane. It was actually a result of pre-existing conditions to the house.
I know.
Well, that house had been hit by every hurricane since Betsy. The pre-existing condition was the last 20 hurricanes, right? In the Biden administration, there was a policy change that was enacted that dragged that house under coverage. As in, suddenly on a day, I was able to tell them, great news, you're covered, right? Their roof got fixed, right? For the next 10 years, they'll be okay, right? And so that is an example of how policy matters. It's not abstract. There is literally things that can be done. It's just like in the healthcare sector, right? People are covered or not covered. And that is a matter of policy.
Can take
We
one
have
more.
a question from online. What can disaster preparedness systems do better to serve those who do not have the means to act ahead of a disaster?
If we look at New Orleans in Katrina, and I'm saying New Orleans because that's where I'm centered, but I know it was the whole coast. I apologize to other people who were impacted by Katrina. The issue really was about money. And I think someone brought that up on the other panel, in that people did not have the resources. It was August 29th. Those who were reliant on support, the check was coming on the 30th. They did not have the resources. They didn't have the cars. So one of the things we can do is make sure that there are local authorities that can support those with lesser ability, so that whatever is needed, which is usually transportation, that all people have access to being able to evacuate. And if indeed there's going to be sheltering in place, then we need to make sure that those places are accessible, they're well stocked, they have what people need to ride out the disaster. So
I mean, that should be the focus of, like, the vulnerable populations should be the ones that we plan for, that we prioritize, that we care about. And Saket, your statistic about it being the opposite way around is crazy, but also logical. Also, we need to learn from the resilience of communities that are struggling on a day-to-day basis, because they're really brilliant at, shifting and coming up with solutions. And so, like, they need to be part of the planning too.
Yeah, an example of that is in New Orleans during the pandemic. We partnered with the city of New Orleans to build a permanent standing resilience corps. We took people who had lost their service industry jobs. New Orleans is, of course, a tourism and service city. People lost their jobs. The jobs they lost were minimum wage jobs, right, in restaurants and so on. We retrained them to be professional resilience workers. They worked round the clock. Well, nobody worked round the clock, but the corps as a corps worked round the clock at wages starting at $24 an hour. And for 2 years, they helped prepare people, not just through the pandemic, but prepare people for successive hurricanes, power shortages, and things like that. And that kind of model, I think the interesting thing about it is it doesn't posit that one group is vulnerable and another group is, the white knights that are going to come and save them. It's the people who live deep in neighborhoods who can prepare. It's people in their own cities, their own neighborhoods, who are the white blood cells of that place. And I think that's the approach we really need to take, is local people where they are getting good jobs to run the kind of preparation work that Dr. Fink was talking about.
Amen.
Could probably take one more question.
Can I ask Saket a question?
Yeah.
Are your workers afraid to show up? I mean, I just can't stop thinking about the workers who come for all these disasters, the people you work with, and the fear in certain communities right now. So what's happening in actual disasters?
Yeah, it's a tough time. Most of these workers are undocumented. It's a very hard climate. I received a call last week of a worker who plans to go respond to the next hurricane where it hits, but wanted my help in teaching him how to write his will. So that's the the dire stress. But I'll tell you something else, though, about these workers. What I see again and again is immigrant workers gather and arrive at a hurricane-hit town, and they often rebuild the homes of people who, right before the hurricane, thought of immigrants as the enemy, right, in red states. And we take that opportunity because of the work the immigrants are doing. The homeowners express gratitude. And in that gratitude, there's an opening, right? There's an opening to build a bond and to turn that spontaneous bond into a long-lasting friendship, and to weave many of those friendships into the kind of social cohesion we need, the kind of new civic fabric we need. And so we take responsibility for protecting workers, yes, but also workers have their own power to build this new cohesiveness, to depolarize a place. And that's part of the power of this workforce.
Well, Saket, Denese, Sheri, thank you so much for giving us so much to chew on in a great conversation.